Hi, and welcome back. We're back on the deliveries after a prior C-section. The reason we have separate codes for these outside of the 59400 and 59510 is because that a mom that has had a prior cesarean delivery is at a higher risk of complications. So the two codes that you see here are actually weighted higher and because they have a higher risk of complications trying to have a vaginal birth after a C-section or letting a mom labor and then still having to have a cesarean delivery. Okay, your routine OB care does not include any of the following. So any medical complications of pregnancies, diagnostic or special procedures like fetal invasive tests, amnios, ultrasounds, those are not included in routine care. Physician office visits for conditions unrelated to a pregnancy, a motor vehicle accident, any other accident, maybe a mom stepped off a curb, and other illness or injury such as a cold, flu, sore throat, sprain, or strain. All of these need to be coded separately outside of any routine global package. Okay, services outside of the routine, which we were talking about. The following services you would code individually with codes from either the E&M section of your CPT book or your surgery section. So an admission for observation prior to delivery, the delivery would not occur on this admission. Any medical complications that complicate the management of labor and delivery, a tubal ligation after the delivery, management of any surgical problems, and external cephalic version, which would be if the baby was not head down and in the right position and the doctor tried to manually manipulate the fetus so that way we could get it in the right position for delivery. All of these codes would be outside of any routine OB care. Okay, here's a list of some of your medical complications of pregnancy. They range from cardiac, neuro, hypertension, toxemia, hyperemesis, diabetes, preterm labor, any trauma like the motor vehicle accident we were talking about, or premature rupture of membranes. These are all possible complications of pregnancy which can be coded for outside of any other routine OB care. And briefly, abortion coding. Remember I said abortions and miscarriages can be used interchangeably. Well, treatment of abortions is based on the type of abortion and the surgical treatment that is performed. An incomplete abortion is when a miscarriage has started but there are still retained products of conception within the uterus and maybe the mom is still continuing to bleed. An incomplete abortion would be coded 59812 if it was completed surgically. A missed abortion is when there is a retained dead fetus within the uterus and it hasn't been expelled. And so in order for a missed abortion, the mom can either wait to have it miscarry on its own or it can go in and be surgically removed. Missed abortions are coded in the following sections 59820 to 59821. A septic abortion is an abortion because of a pelvic or uterine infection. The code for that is 59830. Any induced abortions, 59840 to 59857. It is important to remember that an induced abortion can be for many reasons other than elective. Moms can also choose to terminate a pregnancy either due to a fetal anomaly, possible incompatibility with life, or due to the health risk or possible risk of death to the mother. Personally, I enjoy coding OB cases, and I hope this snapshot of OB coding makes it easier for you and a little less scary. Thanks for listening, and again, happy coding.